Welcome to the Her Story Circle podcast, the podcast that brings you the extraordinary tales of everyday women who are changing the world. I'm your host, Gertrude Mache, and I'd like to acknowledge traditional custodians of the land on which we meet today. I also like to pay my respects to elders, past, present, and emerging. Every week, we dive into the lives, challenges, and triumphs of women from all four corners of the globe. We're here to inspire, enlighten, and connect, sharing stories that uplift and empower. So grab a cup of coffee, settle in, and join us as we explore the incredible journeys of women shaping our future. This is Her Story, where every woman's voice matters. Hello, everybody, and welcome back to the Her Story Circle. This is Gertrude Mache here in beautiful Melbourne, Australia. And as you know, today I am focused on women's health and have a fantastic guest. Welcome, welcome, welcome to our tribe. Please tell everybody your full name, where you're based, and share your story with us today.
Thank you very much, Gertrude. It's just a pleasure to be with you today. I'm Dr. Ron Eaker. I'm an OBGYN, obstetrician gynecologist, been practicing in Augusta, Georgia, home of the Masters Golf Tournament, which many of your international guests would probably recognize. And I've been in practice of OBGYN for 34 years now. So I feel like a real veteran of the trenches. But for the last 10 or 15 years, I've devoted the majority of my practice to menopausal wellness, menopausal health. It began many years ago when I was in practice and began to work with a lot of women who were struggling with many menopausal issues. And at the time, there was not a lot of good information. In fact, menopause was one of those things that a lot of women didn't talk about a lot. And I realized there was a real deficit there. There was really a problem. Of course, one of the initial issues I ran into was at the time I had two deficiencies in the minds of a lot of patients that I was trying to work with. Number one, I was too young. And number two, I was male. And that did create some issues right off the bat. But then it really became very evident that to be a compassionate guide, you don't have to actually be experiencing exactly the same thing. It's like you would not worry so much whether or not a surgeon had their gallbladder taken out as long as they knew exactly what they were doing when they were working with you. So I overcame some of those early obstacles when women realized that I was really working with them as a partner. MD does not stand for menopause director. It is actually a partnership. And that really is what spawned my interest, was reaching out and looking at the different ways to help women experience this transition, help them to navigate what is truly a normal, natural transition. And that's the approach that I took, and still believe that it's not a disease. It's not a time to give up. Margaret Mead, one of the great anthropologists, talked about postmenopausal zest. And I love that term. And it embodies what I really try to express in both my writings and my online course and in my own practice, is that this is a time when very often women can experience a new ability to make the most of the many different blessings that they have, and then overcome some of the challenges that they might be experiencing. It's a time when you have a lot of additional knowledge and maturity. I kind of jokingly sometimes refer to menopause as puberty with experience. There's a lot of hormonal changes, a lot of shifts, and being able to understand what those are, and then utilize the multitude of tools that are available to really make this transition a joyful time. You know, the average woman is going to spend a third of her life in the menopause, and it's certainly not a time to be giving up, to be complacent. There's so much value in life experience for yourself and those around you, those that you love, those that you care about. So my mission in these last many years has been to serve as a guide. The woman that I work with is the hero of the story, and I'm simply the guide that's trying to get her from one place to another place. And we work together hand in hand and walk down that path and use the many tools and information and just pulling things from a variety of both traditional and non-traditional medical worlds to truly make that possible. And that really encapsulates my practice and what I try to encourage.
Wow, thank you, Dr. Ron. It is truly a very, very challenging time in any woman's life. You know, going through the change, it's scary, it's uncertainty. Now, what inspired your innovative patient education program on menopause, which earned you the National Focus on Patient Education Award?
Well, the inspiration really solely came from my own patients. You know, I felt like that as a partner, as someone who was listening day in and day out to women who were living very productive lives, were contributing to not only their family and their friends and their work, and then began experiencing things that they couldn't explain, things that were challenging, whether they're physical changes like hot flashes, or whether there were emotional changes that were frightening, that were oftentimes confusing. And listening to those folks and understanding that there was a tremendous amount that the folks still had to offer. And again, this was not a time to just settle with, oh, is this the way it's going to be? And taking that to heart, realizing that there were a lot of options that were out there. Many people get confused in the menopause, and one of my big platforms is education. I think if women understand options, then oftentimes they can make incredibly powerful and beneficial decisions, but they have to have that understanding. So a lot of the work that I do is on education, and that really was the impetus for writing the book, for doing the course. It all stems from the absolute belief that if a woman understands her body, understands her individual scenario, that she's much more likely to make a decision, whether it's taking action with supplements or sleep or exercise or medications, that she truly is going to be able to take back control. Because quite honestly, that's one of the biggest issues that I hear day in and day out that is frightening to women, is that loss of control. You have someone who has been amazing and doing incredible things in their personal life, in their family life, in their job, in their career. And all of a sudden, the coping mechanisms that were allowing them to be that successful have changed, and they're not working like they were before. So it can be a very frightening time for women. And I think that's where the educational component comes in. You give them back that power. You give them back the ability to make choices, to understand that they're not broken. This is a normal, natural transition. Yes, they may have symptoms. They may have multitudes of challenges, but they can be overcome. And it's just a matter of starting out with that education and then taking action. And that really was the second key. Is it's not good enough just to know what to do. You have to know how to implement that, how to put that into place. And one thing I've learned very early is that that's unique for every woman. That experience during this transition is so unique and it's so different. There's no way to cookbook this. This has never been a one size fits all. And just
Mm.
due to the nature of getting information out there, oftentimes, sometimes it may sound as if, oh, everyone should do this, everyone should take hormones, everyone should use this supplement, or no one should take hormones, or no one should do this particular exercise. And that's why it's so important that you really understand that this is your journey. This is your unique experience. Yes, there may be some correlation and some commonality with others, but it truly is your unique journey. And being able to
Mm.
explore the different options, and that's a key, underline that word and put it in bold print, options,
Mm.
for women to understand. And that's my mission. That's my goal, is to try to highlight those options so that women can make choices that bring this as a joyful time.
So let's talk a little bit about those options. Hormone replacement therapy being one of them. There's a lot of fear around hormone replacement therapy, especially the fear of getting breast cancer. What are some options that women can actually have when they transition into menopause?
Yes, you're exactly right. I think the word you used is absolutely the problem, and that's fear. And a lot of that fear comes from confusion, from misinformation. Probably no other area of menopause has been so confusing for women than the area of hormone replacement. There was a massive study back in the early to mid 2000s called the Women's Health Initiative that had many thousands of women, and it was designed to try to answer some of the questions about the safety and efficacy of hormone replacement. And quite honestly, what it did was actually muddy the waters even further. It created even more confusion. The reality is there is not any absolute contraindications for any one person. Each person has to look at their own history. And I'll just use an example so someone might understand. Let's just say a woman comes in to see me and is having terrible menopausal symptoms. Let's just say she has bad hot flashes. Well, the first question, regardless of the symptom, is how bothersome are these? Are they disrupting your normal lifestyle? Are they simply an annoyance? The reality is that most menopausal symptoms are only going to exist for a few years. Now, that's a global statement. There are women on the upper end of that bell curve who are still experiencing menopausal symptoms in their mid 60s. But in general, these are not
Mm.
recognized as lifelong symptoms. And we'll talk about a couple of exceptions there. So the first question is always, is what I'm experiencing interfering with my life? Is it creating a medical issue? Is it just disrupting my sexual function? Whatever it is, determining how aggressive to be in the approach. And if the simple answer is yes, I want something done, or I want something done yesterday, then the next question is, well, what are my options? And I always like to present it from the standpoint of really looking at three different categories. And I start out talking about lifestyle. You have to consider things like stress management. You know, reducing stress is one of the best tools for cornering hot flashes. In fact, the number one symptom of menopause, the hot flash, are oftentimes made incredibly worse when women are placed in stressful situations. So it would be crazy not to take that into consideration as part of the treatment protocol. So we look at lifestyle, we look at diet. Diet has a huge impact on things like hot flashes. For example, increasing soy-based foods, or what we call phytoestrogen foods in the diet, sometimes by themselves can eliminate hot flashes and other things like mood swings. So we look at those foundational changes and start there. Always start there, because those lifestyle changes have magnified benefits beyond just menopause. Many of
Yeah.
the nutritional changes, for example, actually have a beneficial effect on maybe weight or maybe sleep. So all of these things are intertwined. And we talk about things like sleep, which play such a huge role in the menopause. And then we kind of look at another category, and that's some of what we would call the natural solutions. Now, I cringe a little bit when I use that terminology because no one really knows what that means. I think each person has their own idea of what natural means. I try to define that a bit by just talking about non-prescription medications. And then you have to be careful because in different countries, there are different rules for what substances are prescription only and which are not. So even there, you have to be a little careful when you're dealing outside of your own venue. But there are a number of natural substances. For example, I mentioned the phytoestrogens. Those are things like the herb black cohosh or soy-based products, soybeans, and those types of mesotempo, any of those types of things can be a possibility. We know some of the B vitamins have been helpful in some of the mood changes associated with menopause. And then the third category, and again, I'm doing this, presenting this to women just so they're aware of the cornucopia of options that are available to them, and then we get more targeted. So we do talk about hormone replacement, and I probably spend more time in education talking about hormone replacement than anything else because that probably has the greatest misinformation of any category. And it's a very broad it's not a one size fits all, and using the term hormone replacement encompass just a multitude of different medications. And then you can even subdivide that into non-hormonal prescription medicines that can be used to target specific symptoms. For example, there are a category of medicines traditionally used for depression that we can use in a much lower dose that can be very effective for hot flashes. So, for example, if a woman comes in and has terrible hot flashes and also has some clinical depressive symptoms, this is a win-win for her. If she's already doing the foundational stuff, doing the sleep, the stress management, and still having these issues, now we have something we can offer that's going to help in both of those primary symptoms. But it really is a global approach. You never want to compartmentalize any of these approaches and forget about the other.
So, what would you say are some of the most common misconceptions that you've encountered in women's health, and how do you address them?
Well, in particular, as we think about menopause, you really hit on a very important one, and that's the association of hormone replacement therapy and cancer, and in particular with breast cancer. And I think it's very important to put a lot of these studies in context. And the way I explain it to patients, for example, specifically with the breast cancer example, is that when we look at that large, massive study, and quite honestly, we'll never duplicate that because it was over 50,000 women and it was incredibly expensive, and it just is not going to happen again. So it's the largest cohort of women that we have looking at these questions about breast cancer and hormone replacement. And again, I'm using that term rather generically, but it's very important that you specify exactly what you mean when you talk about hormone replacement. For example, in this large, massive study, when you looked at the data, there were 8 additional breast cancers out of 10,000 women using the hormones. So that is very important to clarify that there was a headline back in the mid-2000s when the study first came out that said hormone replacement responsible for 26% risk of breast cancer. Now, when you see that hormone, that headline, and then you hear that second statistic, 8 out of 10,000, that's exactly from the same numbers. It's just how it is manifested and how it's reported. And it also shows how there are so many ways to twist and turn statistics that you really have to have someone that you trust interpreting those for you. So that's an
Yes.
area that is probably more fraught with confusion than any other area regarding menopause. And of course, the second area is just knowing that there are choices. Many people think that dealing with menopausal symptoms is kind of an either or. Either I take hormones or I don't. There are so
Right.
many other things that women can do. Uh, did you realize that aerobic exercise is one of the best treatments for hot flashes? There are
Okay.
just tremendous data out there looking at different options and different choices. So I think that's one of the greatest of information that I want someone to walk away from this interview with, is that there are options, there are choices, there are many different ways of dealing with these symptoms. And it's a matter of being able to educate. Really, the motivation for putting together my online course was to provide that type of education in an understandable, concise format, so that women could learn where to get that without having to get their PhD in hormone replacement.
So, based on your expertise, what key advice would you give women regarding weight loss and overall wellness? You've mentioned the um, aerobic exercise. I've heard from other sources that lifting weights also helps with your bone density long term. Let's talk about that as well in terms of managing your weight. It's very, very difficult to shake the weight after a certain age.
Yeah, that's a great question. And about 8 years ago, I went back and got board certified in bariatric medicine, which is weight management medicine, for that
Right.
reason, because I was seeing so many women in the practice who were struggling with weight. And there's no question that as you get into the menopausal time frame, your basic metabolic rate, the amount of energy that's required to run your body, decreases. So if
Yes.
everything else is the same, if no other changes happen, you will gradually gain weight over time for that one reason alone. So you have
Right.
to make some changes. Those are metabolic changes that are set. So you have to be intentional. You have to make changes to be able to counterbalance that. And really, when
Okay.
it comes to weight management, it's nutrition, nutrition, nutrition. Activity level plays a role, and that's important. And I never want to disavow of the importance there, but we sometimes magnify how much exercise plays a role. I would much rather someone eat properly and eat well than and not be as active as I'd rather than have someone train for a marathon and horrible nutrition. So it truly,
Right.
nutrition is king. Now, what's interesting, once you lose the weight and want to maintain it, that's when the
Mhm.
exercise and the activity becomes paramount. It's almost like those things shift. So in the maintenance phase, being active, staying active, you mentioned about the bone health. Absolutely
Yes.
critical for women in the menopause, because the rate of bone loss greatly accelerates in the menopause. Being
Okay.
active, physically active, strength bearing exercises, absolutely vital to preserving bone mass and preventing osteopenia and osteoporosis in the menopause. We know that as women age, if they preserve muscle mass, it reduces their likelihood for a lot of the chronic conditions that shorten your health span. There's a very much
Right.
correlation between muscle mass and longevity. So being active, if I had to pick one, if you pinned me down and said you can only say one thing to keep healthy as long as possible, it would be exercise.
Okay. So, based on your extensive experience, what advice would you give to upcoming medical professionals who are entering the field of women's health?
One thing is most important. Listen. Listen to your patients. 95% of the time, patients will tell you what's wrong with them if you'll listen. That has to be a dialogue. It has to be where you will sit back and be understanding, be empathetic, and not be judgmental. Allow women to express themselves, establish the relationship. We live in the US, unfortunately, in a medical culture where it's volume based and you are literally timed as to how long you spend with the patient. It's an abysmal system in many instances, and it does not lend itself towards the interactive communication that is essential for dealing with menopausal issues or any health issue. So my advice to any of the young doctors that I work with is just be quiet and listen.
I love that. So from your experience in writing a monthly health column, what topics do you find have resonated most with women who follow you through your writing?
Well, of course, in the last few years, it's been COVID, which has obviously been an issue around the world. And the impact that that has had on women's health, on things like fertility, on long COVID, and the impact that that's had on just a variety of substances. I've worked a lot recently with women on cardiovascular health and looking at ways of reducing the chronic illnesses. That's one of the biggest area that I think women have become more interested in, is how can I help prevent things like cognitive decline and Alzheimer's? How can I decrease my chance of heart disease? 1 out of 3 women over 50 will die of heart disease. So that has become a big topic in what are the tools for preventing stroke, which I put in that same category. Obviously, when you think about chronic illness, things like cancer, diabetes, cardiovascular disease, stroke, dementia, limiting those can greatly expand this health span. And I'm very encouraged that women seem to be much more tuned in now to the concept of health span. It's not about lifespan. It's not about how long you live. It's how well you live. And that's what health span is. And we're seeing more and more women who are very interested in preventive care in ways that they can take control and that they can become the best that they can be during that third of life, that they can play such a role in their own well-being, but also as role models for those that they care about. When you look at studies looking at a household or a family, it's the woman that directs 80% of the medical decisions in the household. The influence that a woman has in a home is vast. It really, it dwarfs really what the role that the man plays when you look at the studies. So there is a potential legacy that can be established for children and grandchildren. Kids learn by observing. It doesn't so matter much what you tell them, it's what they see you do. So the example that you can set in your own health and wellness has ramifications beyond what you can imagine. It's like throwing the pebble in the pond and seeing the ripples expand. That extends to your family and your friends and your associates.
So what future directions or advancements do you see in the field of women's health care?
I truly believe that the focus is going to be prevention. We're so, at least in the United States, we've been so caught up in the putting out the fires and not thinking so much about how the fires start. And I believe we're beginning to understand more about things like genomics and metabolomics and all these tools that we can utilize to really focus on prevention, to try to identify potential risk factors early, make changes, make alterations, and prevent the process, the disease from ever occurring. I want someone to come see me in my office, not when they're sick. I will see them, of course, when they're sick, but I'd much rather them come in so I could help them stay well. And that's a real shift in philosophy. But I think women in particular understand the importance of prevention. They're used to the mammograms, they're used to the pap smears, they're used to kind of focusing on a preventative mindset. And I think as they get older, I think that wisdom is going to come through, and we're going to see an explosion in our ability to really prevent problems and create this joyous experience as you age.
That is fantastic. Any parting thoughts for our listeners today, Dr. Ron?
Well, it's become very evident in the last few years that these changes of menopause are universal. Whether you're in Australia or China or Alaska or South Florida or South America, these are universally experienced. There are some cultural impacts, which has been quite interesting when you look at the studies of different behaviors in different cultures, but yet the physiology remains the same. So these things we've been talking about today, regardless of where you are in the world, has application. And if I could leave you with any thought, it's that this is a time to be joyful, a time to not be complacent with the status quo, and a time to embrace your options and be the most beautiful person that you were designed to be, and therefore bless those that are around you.
And I love that quote that you gave us in the very beginning. If you could repeat that again, what is her name? The anthropologist?
Yes, Margaret Mead said this was a time.
Mead.
Yeah, this was a time for postmenopausal zest. That's this energy.
I love that.
This energy that comes from the wisdom and the maturity and the life experience. You just think about this life experience that you've accumulated and the value that has for those that you care about, that those that want to learn from you, and you can use this time not only for your own well-being, but what an amazing potential impact you can have on your own community and literally the world.
I love it. Dr. Ron, thank you so much for coming online and sharing your wisdom with us today. Very, very inspiring. How can people find you? How can they follow you? Do you have a website?
Yes, you can find me on roneaker.com. The website that really is for menopause would be Women's Online Wellness, just all one word, no apostrophe, just www.womensonlinewellness. And there you'll find all our resources, all our information about how if you want to learn more about menopause and options and treatments and really get all your questions answered, that's a great place to start.
Fantastic. Thank you so much, Dr. Ron. I've got that website at the bottom of the screen. Do reach out, ladies. You know you can take control of your health and have a vibrant life. It's not just about living long, but living long healthy. Thank you, Dr. Ron. This has been an amazing interview.
Thank you.
I'll be back again tomorrow, everybody. Tune in. As you know, the Her Story Circle is bringing you knowledge and skills on how to take care of yourself. Both your physical, mental well-being is absolutely crucial. Have a fantastic day, morning, or evening, wherever you are in the world, and bye for now. Thank you for tuning into the Her Story Circle podcast. I hope today's story has inspired you to believe in the power of our stories and the difference you can make in the world when you use your voice. I'm Gertrude Mache, and it's been an honor to share this space with you, where voices from all walks of life come together to weave a rich tapestry of diverse perspectives. Don't forget to subscribe, rate, and review our podcast to help us share these stories with more listeners. Follow us on social media by looking for the Her Story Circle podcast for more updates. And join us tomorrow for another episode filled with courage, resilience, and empowerment. Remember, your story matters, and together we're building a stronger, more inclusive world. Until next time, keep making her story.